So I probably decided in my teens that I would have wanted to join the profession of nursing, and that was predominantly because at the school that I attended we had to do what was called community service on a Friday morning, and at that time I was placed within a old people's residential home, and the manager that owned the home was a nurse, qualified nurse, who'd come out of the NHS and opened a residential establishment, and it was just really as there was more and more residential establishments taking off. But her nature and her persona with the residents within that setting and her passion for nursing led me very much to believe, she inspired me so much that that was the person that I want to be. And even today I do look back, because unfortunately she passed away at a young age, and I do look back on that time and think if I am half the nurse that that lady was at that time, then I'm doing a really good job. And I didn't actually join straight away, only because I didn't do as well as planned at school. So I did dental nursing for a short while, but knew that my passion was always within nursing. So I went back to college and resat, which was then GCSEs, and got enough qualifications for the entry requirement, because it changed obviously then to university, and started in the mid-90s to do my nurse training. Okay, so I think I've been fortunate to be a diabetes specialist nurse now since 2000. So I have been doing it for quite a long time and have gained lots and lots of valuable experience. And I think with any area that you work in, over time you can become a little bit blasé to that diagnosis of telling people that they've got things wrong with them. But back a few years ago I ended up with an admission myself into hospital, and it made me really re-evaluate the way that I talk to patients and the way I do explain things, and that how they actually feel when they get that diagnosis. And I do believe that has enabled me to be a better practitioner and be able to see both from a professional side and a patient side, because it is very daunting. Some patients will take it full on and they will want to know everything there and then. Other people with diabetes will want to have that drip fed, and I think it's about making sure that when we're giving that diagnosis or any further care to any person with diabetes, that we individualise that care to that individual at the time of the appointment. So I feel really, really privileged and fortunate to work in the area of diabetes and to have done the job that I've done for so many years. And just as we were talking before we came in today, I did say that, you know, a little while back, a couple of years back, we were at home and my husband said to me, what job would you do if you can do any job within the world? And I sat there for probably 30 minutes trying to think, and I couldn't think of anything. And in the end I said I'd probably do what I do now, which he was absolutely gobsmacked at. And I think the reason for that is that, yes, diabetes is a long-term condition that can be very daunting for patients and does carry, as we know, many complications associated with diabetes, but we can make a massive difference. I feel that for patients, as a diabetes specialist nurse, if we get the rapport right and we give the correct education and we work in partnership with that person with diabetes, we can make a difference to their health and their long-term health outcomes. So we've had, as I say, because I have worked as a diabetes specialist nurse solely and done that now for several years, you know, there is quite a few patients that I could think of off the top of my head. One particular gentleman came to see us back a few years now, so it was not long after GLP-1 medication first came out, was morbidly obese, didn't particularly at that time want to make changes. We had a long discussion, talked about the benefits of certain medications, talked about GLP-1 and the potential side of weight loss, and he was very keen for that. I think one of the things with it is that we need to remember the whole way through the the implications of diet and lifestyle, because I think it's important to stress that as well as the medication. Otherwise people with diabetes do go away feeling that the medication's going to do it for them. And he also, because we were fortunate to be working in an MDT team with the dietitian on board, he was able to see the dietitian, have support from all of us at that time, and he actually went away and overall he lost 5.5 stone and put his diabetes into remission and came off all of his medication. So he was a huge success story for us. I think the biggest challenge is, and I would say a lot with people with type 1 diabetes, where they're having recurrent readmissions for diabetic ketoacidosis, and it can be frustrating because you feel that you can help them with the education, and if they'll work with you and take it on board and they will work in conjunction and communicate with you, that you can really help them and stop the damage that is occurring from the recurrent diabetic ketoacidosis, and that can be quite frustrating when people don't want to engage with you for varying reasons. For people that have diabetes, I think the message that I would be giving out today is that yes, for any of us that maybe already have diabetes or get diagnosed in the future, nobody wants to get diagnosed with a long-term health condition. I absolutely understand that. But if you work in conjunction with the healthcare professionals, most of the complications, if not all of the complications associated with diabetes, can either be prevented or certainly slowed or stopped down in the early stages. But the only way that you're going to do that is by attending for your regular reviews, either with your practice nurse or your GP or your diabetes specialist nurse, whoever's caring for you at the given time. Your retinal screening also is really important, because unfortunately until the damage is done from retinopathy you are not actually aware of it, whereas with the retinopathy screening they're able to pick that damage up at a really early stage and prevent that from getting any worse. So if everybody attends for their retinopathy screening today, we shouldn't have people going blind from diabetes with the technology that we've got available. When you're attending for your regular review, you'll get your feet checked as well, so obviously that's going to keep on top of that, and if there is any concerns, we can refer on really quickly, and locally we've got lots of resources that are available to support that and prevent those amputations and other complications associated with diabetes that we see. So we deliver lots of structured education, predominantly Desmond, and at the end of all of the Desmond sessions I always say to the group that are there, it's been a really good day, there's been a lot of information to take away from today, but if you can only take one message away for your diabetes, it's the absolute importance of attending for your screening, because again, when your blood glucose levels start to rise, you're often not symptomatic from that, whereas if you're having regular blood tests, we're able to see that and act on that and do something about it at a much earlier stage to prevent those long-term complications for you.